Addison's disease, a long-term endocrine disorder resulting from insufficient amounts of hormones released by the adrenal glands, a pair of walnut-sized organs above the kidneys. The most common cause of Addison's disease is the problem with the immune system. It occurs when the adrenal glands are damaged and do not produce a sufficient number of hormones. The symptoms usually develop gradually and may vary from one individual to another. The most common symptoms are fatigue and muscle weakness. The condition is diagnosed based on medical history, physical examination, and few tests. Primary adrenal insufficiency, the condition where the adrenal glands are damaged as a result of trauma or infection. Secondary adrenal insufficiency, the adrenal glands are normal and function. Well, they produce insufficient hormones as a result of a disease of the pituitary gland. The pituitary gland produces adrenal corticotropic hormone ACAS that stimulates the adrenal glands to produce hormones when ACAS is produced in fewer amounts. It affects the working of adrenal glands. The symptoms usually develop gradually and may vary from one individual to another. The common symptoms include extreme tiredness, weak muscles, reduced appetite, weight loss, darkening of the skin, hyperpigmentation, reduced heart rate or low blood pressure, lightheadedness and fainting, salt craving, low blood sugar, hypoglycemia, nausea or vomiting, diarrhea, abdominal pain, muscle or joint pains, irritability, depression, body hair loss, or sexual dysfunction in women. In some cases, injury or illness can cause a serious emergency condition called Addisonian crisis. It is characterized by pain in the lower back, abdomen, or legs, severe vomiting and diarrhea that causes dehydration, low blood pressure, blood sugar confusion, fear or restlessness, loss of consciousness, high potassium levels in the blood, hyperkalemia, low sodium levels in the blood, hyponatremia. The most common cause of Addison's disease is the problem with the immune system. It occurs when the adrenal glands are damaged and do not produce a sufficient number of hormones. There are two types of Addison's disease: primary adrenal insufficiency and secondary adrenal insufficiency. Primary adrenal insufficiency, damaged adrenal glands, particularly damaged cortex of the gland, results in inadequate hormone production. Autoimmune diseases where the body's immune cells attack cells of the adrenal gland, infections of the adrenal glands, cancers of the adrenal glands, bleeding into the adrenal glands. Secondary adrenal insufficiency, a rare disorder causes due to diseases or disorders of the pituitary gland. The condition is diagnosed based on medical history, physical examination, and few tests. Blood tests to evaluate levels of sodium, potassium, cortisol, and antibodies associated with Addison's disease. ACE stimulation test. A blood test is done to evaluate cortisol levels in the blood before and after injecting a particular dose of synthetic insulin tolerance test. Insulin is injected to detect pituitary abnormalities. CT scan. Kinetic scan of the abdomen is performed to check for abnormalities in the adrenal glands. Magnetic resonance imaging MRI scan of the brain is performed if secondary adrenal insufficiency is suspected to observe the pituitary gland. The treatment involves the replacement of insufficient hormones through hormone replacement therapies. Prolonged illness may lead to acute adrenal failure or the Addisonian crisis. Shock and death due to the Addisonian crisis. This condition cannot be prevented, but Addisonian crisis can be prevented by following few steps, such as carrying a medical badge or card that indicates Addison's disease and any other associated health conditions. Do not skip your medications. Take your prescribed medications in the right doses and at the right time. Visit your doctor regularly.